Hello everyone, I am Dr. Berkkkaratas. Previously, which medicine is good for erectile dysfunction, etc. I had made such a video. Of course, it's been a while since that was watched. I actually don't understand why this is happening. We have some informative videos overlooked. Essential information. We must continue to engage viewers with an engaging title. But when we catch something from somewhere, we have to continue with that title for a while so that people can watch it and get informed. Which means that the title attracts attention. Our issue, or at least my issue, is that we don't earn any income from our YouTube channel anyway. We don't take ads either. We shoot without ads, sponsorship with anyone, etc. We don't have any agreements either. My concern is for people to benefit, learn the truths, and improve their sexual knowledge. That's our concern. Now let's do the same for premature ejaculation as we did for erectile dysfunction. Which one is good, which one has the least effect, etc. And so on. Now, there's something we need to understand here. There's no medication for premature ejaculation that guarantees you'll use this specific drug and be perfect. If such a drug is really found, I think it will win the Nobel Prize and the problems of billions of people will be solved. But unfortunately, I'm sorry to say that we don't have such a medication. Here, when people talk among themselves, they say, "Hey, I took this medication and it worked incredibly well for me. You should try it too." It doesn't work, even if you take it. So it's highly likely that the medication that works well for your friend may not work for you. That's why it can vary from person to person. But there is no 100% treatment. First, you need to know that, and if you used a cream or a spray and it worked well for you, hold on to it. Because as I said, nothing is 100% certain here. You need to hold on to what makes you happy. First, we need to make sure we don't lose that. First of all, if it started later on, we divide premature ejaculation into two types. One that has been present throughout your life and one that starts later on. So you've been married for 10 years and you've had premature ejaculation in the last 6 months. Definitely go see a doctor. Do not use any medication at all because there could be a reason for this. There could be a physiological reason for it. Premature ejaculation medications are not a treatment, so it saves the situation. At that moment, it allows you to last longer in the relationship, or makes it easier for you to control ejaculation, and then if you don't use it afterward, it won't happen in the next relationship. So it's effective in the moment. Now divorce, now divorce, divorce. Why is it effective in the moment? Ejaculation can be controlled up to a certain point. I always say that, so let's say it's between 0 and 10. 10 is the ejaculation point. We have a number 8 there. You need to be able to fluctuate between 0 and 8, between 5 and 8. When you use medication, it goes like this. Without the medication, you reach 8. With it, slower to 8. Pause and calm before 8. When you use medication, it's a bit slower. But if you want to be able to ejaculate whenever you want, if you want to manage the timing as you wish, you need to learn to pause and calm down before reaching that 8. So, in some way, your behaviors also need to be appropriate. Yes, we've summarized medications like this. Of course, now in the playlist about medications related to premature ejaculation, there are details about the medications. What the active ingredients are, I won't repeat them here. We divide the medications into two groups. We have some pills that are taken orally. And then there are the ones that are applied, the ones that are rubbed on. They are applied as cream and spray. These are used only before the relationship. We have a great video on how to use creams and sprays for premature ejaculation. You can watch that. Please feel free to watch it. The pills are also divided into two types. There are pills used before a relationship and also pills that are taken regularly. We prefer regular medication, especially for married people who have regular sexual intercourse, 2 or 3 times a week and 2 times a week, so that there isn't a constant stress of taking medication. If someone is single or has more open relationship intervals, they can use pre-relationship medications. Pills and medications should definitely be used under a doctor's supervision. So, just like with erectile dysfunction medications, your contacts are not gas stations, cafes, etc. It is not. Your contacts are doctors. It is absolutely necessary to start the appropriate medication at the right dosage under a doctor's supervision. Both can increase it by an average of 2 to 8 times scientifically. So if you are ejaculating in 10 seconds, it can extend that to anywhere between 20 to 80 seconds. Of course, the question is whether it brings happiness. So I mentioned earlier that there is no 100% cure. Actually, they all have a 100% effect. The effect and happiness are two different things. Now, if you are ejaculating in 10 seconds, and when you take the medication it goes up to 20 seconds, then yes, it has 100% effect. Scientifically, it's a great thing. But does it bring happiness in a relationship? It doesn't bring happiness. So let's embrace what brings happiness and also distinguish between effect and happiness. It needs to satisfy both you and the other person. This really doesn't happen to a lot of people. Let me say that there are no side effects from the cream itself. It can cause allergic reactions. The pills also have side effects that need to be monitored. That's why you need to use these carefully and under a doctor's supervision. Technically, there is no such thing as the best medication for premature ejaculation. There are medications that are suitable for the patient, suitable for the individual, and aside from creams and sprays, they don't have any side effects. By the way, you can buy and use the cream and spray yourself. In that case, I prefer using cream instead of spray. This is my personal preference because of its effectiveness. The spray spreads a bit more around, you can't apply it locally and so on. That's why the cream is a bit easier to apply. It can be applied more precisely. I personally prefer that more. But it doesn't matter. If you're happy, you can continue with the spray. Of course, the question here is whether a mill can turn with poured water. I always tell this to my patients. A mill can turn with poured water up to a point. I mean, it can turn for a lifetime, but it's a bit problematic. Now let's do a little calculation like this. You see, people between the ages of 18 and 70 are having sexual intercourse on average. That's sexual life. If we say twice a week, it's one sexual act. 52 weeks multiplied by 52 years times 2, there are about 5,400 to 8,000 sexual acts being performed. This is not about intercourse, nor is it about masturbation. Now, if you're going to engage in so many acts, you might have to rely on a medication or something else before you do. That's a separate issue. But before you go there, my advice is to learn about this. I always say that sexuality is an act that needs to be learned. Ejaculation can be controlled and erection is a reflex. So, you can manage your hardness yourself and you can also control ejaculation. Focus on controlling ejaculation and understanding intercourse actions. Problems arise when incorrect techniques are applied. Only 2 to 3% may need medication. So, when you take that incorrect approach to masturbation and apply it to intercourse, that's when the problems start. First, you need to learn what should be done in a relationship, what to pay attention to, and how to control your ejaculation. Then, if necessary, we find that only about 2 to 3% of individuals with proper behaviors end up needing to use medication. We have an ejaculation control program. Now everyone knows. In the BODE program, for example, we end up having to start medication for 2 to 3 or at most 4 out of 100 people. It's not because he can't control it. Because the intervals are very short. So for example, it can go from 30 seconds to 1.20, 180, and it can last up to 4 to 5 minutes or even 6 to 10 minutes. But of course, since he has to stop every 30-40 seconds, what do? For example, we start with a cream or medication. The intervals are also getting longer. This is how he finds happiness. Learning the desired behavior from you is very easy. It takes 12 weeks to learn. You will have given up on 2 relationships a week. You will have given up on 24 relationships. In other words, you can ignore 24 of the 5408 relationships, get training at that time, and continue happily in the remaining 5,300 odd relationships. Of course, if medication is necessary, it will be started, but at least you will know that you have to use medication at the same time. Thank you.